Current statistics indicate that the Shoalhaven region experiences a higher burden of poor mental health, being above the New South Wales average. The region's help-seeking behaviours in receiving appropriate mental health treatment is also significantly low. Regrettably, we as a region are also overrepresented when it comes to increased suicide rates. Most of us are familiar with the old African proverb, "It takes a village to raise a child." Capturing the spirit of that particular proverb, we here at Mind the GaP understand the necessity of whole-of-community participation to address the many components of what we collectively call mental health. We are reaching out to the Shoalhaven's diverse groups of community members and organisations and invite a collaborative mindset to focus on the task of improving mental health within this region.
The Mind the GaP project has 3 interlocking strands. One is clinical service to support people who have mental health needs. The second is making sure that we've got research that informs best clinical practice, but also researches new practice and building up community resilience. And thirdly, we've got an educational facility here that we can work with community. So if we want to do some parenting work, if we want to do some bullying prevention type work, we've got a wonderful facility that community can use to engage in those sorts of activities. And by having Lifeline South Coast in the building working alongside the researchers, we can get real world challenges into the research focus very quickly and work out ways of tackling things that perhaps haven't been considered before. Instead of a more traditional model of a university saying to community that we have particular research ideas and would the community like to take part in those, we flip the model the other way around and we say to community, what are your ideas for reducing youth suicide? What are your ideas for building up community resilience? And then we work with community to investigate what works and perhaps what doesn't work.
My life has been touched by those who have been faced with mental ill health. It's ongoing now. I have young people who contact me, they're being bullied at school. I have older people who are being bullied at work. I have others who come to me in quite desperate straits, they have nowhere to live. It has been an ongoing issue for me and probably growing. This is the culmination of something where we can serve our community in a way that we probably couldn't have done before. We need to celebrate all your energy, everything that you do for community, and when we join together, we are an absolute force to be reckoned with.